Today we're going to talk about diabetes and how physical activity can impact the disease progression. So diabetes mellitus is essentially when blood glucose is poorly controlled, and there's a couple different types, but we're going to talk about two of them. So type 1 diabetes mellitus is essentially like an autoimmune process in which your pancreas cells are like damaged, and though your pancreas secretes insulin, and without insulin you can't pull glucose out of your bloodstream to shuttle them into your cells. So a lot of different things can happen, like hyperglycemia, which is an elevation of glucose in your blood, and that's essentially the first type. Type 2 diabetes mellitus is caused by insulin resistance, usually related to prolonged elevated blood sugar levels, actually a pretty strong genetic and lifestyle component, as well as diet, right? And the proportion is about 90% type 2 diabetes mellitus in the United States. And the prevalence for these conditions, or how many people that it impacts, is pretty large. So actually almost 100 million people in the United States, or 1/3 of the US population, is pre-diabetic, and actual diabetes mellitus impacts over 10% of the United States population. And this is important because it's the 7th leading cause of death in the United States. And what we're going to talk about today, physical exercise, is a pretty big component in managing this disease process. So some of the signs and symptoms of diabetes are sleep deprivation. So sleep is very important for many different things, but one of the things is glucose regulation, because if you're not sleeping well, your cortisol is going to be messed up, and cortisol has to do with your glucose metabolism. So if your glucose is elevated because you didn't sleep that well the night before, that long term is going to kind of degrade your insulin sensitivity. And when I say insulin sensitivity, that's basically your ability for the cells in your body to absorb glucose from your bloodstream. And why type 2 diabetics have reduced sensitivity is because all day long their cells are bombarded with excess glucose, and that makes the receptors kind of calloused in a way. So this prolonged hyperglycemia, or high blood sugar in the blood vessels, can actually cause things like blindness, because you have blood vessels in your eyes and your retina, and when that gets glycated, or glucose kind of attacks it and damages it, it can cause eye-related problems. So your ophthalmologist should also be consulted if you suspect you have diabetes. Also, neuropathy, so diabetic neuropathy. So neuro is nerve, path is just disease, so it's nerve damage, right? So you can actually have peripheral neuropathy in your hands and your feet, which means that you might feel pins and needles, or actually just reduced sensation completely. This can reduce that sensation and make your balance more poor, because without sensation you can't really feel where your feet are in space, and that can lead to falls, right? One other thing that can happen is ulcers. So ulcers are basically just wounds, because if you can't feel your skin, you can't feel wounds. So that might be a little weird to some of you, but that's why you think diabetics sometimes have amputations, is because they'll develop wounds, they can't feel them, they get infected, doctors have to amputate. So those are some of the signs and symptoms. Hypoglycemia is low sugar. Of less than really 100, but less than 70 can really make you feel faint, dizzy, irritable, weak, shaky, and depending on how low you get, it can actually cause things like seizures, fainting. So it's pretty serious, and you should be consulting your medical professional if you're having that kind of symptom, right? The most common symptoms are usually like urinary frequency, excessive thirst, and hunger. And these are probably related to the osmolarity, or the concentration of glucose that your kidney has to buffer. So if you have a really high concentration of something in your bloodstream, you're going to drink water to dilute it. And that's just your brain telling you, hey, something's going on here. And here we get to physical activity. So how can we actually help this disease process? So physical activity and exercise. So I would say physical activity is more things like walking, gardening, just having an active job, or running errands. So this is just non-intentional activity. And movement can help regulate blood glucose because to move your body in space, your skeletal muscles require energy. And this additional activity can reduce cardiovascular disease risk. It can help with weight loss, and it can actually improve physical and mental health. So that's pretty cool. And regular activity may prevent or delay type 2 diabetes mellitus development. We'll get into why that's a little bit more obvious later. So those who have diabetes are encouraged to be active throughout the day. So being sedentary is pretty bad for the disease process because you're just sitting in your own glucose and excess energy. So every 30 minutes or so, you should take breaks from being sedentary to do a light activity to help regulate that blood glucose. And this could be just for 3 to 15 minutes, has been shown to improve glycemic control, right? One thing that might be useful is a pedometer. So a pedometer is a step counter, and the goal here should be to get 7,500 steps per day and avoid taking less than 5,000 steps per day, because this is just trying to improve our energy expenditure, which would help with glucose in the blood, right? So aerobic exercise is exercise that's continuous and it's low enough intensity that you're not shifting into your like lactate threshold usually, especially if your disease state is pretty severe, because if you're in a complicated state, you might not want to elevate your blood pressure so high, right? So activities like rowing, walking, swimming, and running can be beneficial to regulating glucose. So during exercise, you're going to pull that glucose out of the blood into the skeletal muscle with and without the use of insulin. And this can be really beneficial because if insulin's not working that well, you can actually use exercise to kind of help fuel the muscle cells and pull that glucose out of the blood. And aerobic exercise can increase glucose uptake by up to 500% in the short term. So that's pretty incredible, but it makes sense, right? If you're going to be doing a high intensity activity, you're really going to be using a lot of energy from the blood. And insulin sensitivity, this is pretty cool, can improve after 2 to 72 hours of exercise. And this is because you're basically just telling your body, your cells, like, hey, we are going to pull glucose into the cells and we really need it because you're going to burn the glucose and it's going to just help sensitize the cells. Because if you're sedentary all day, you have really no need for that excess calories or excess glucose in the bloodstream. But if you're actually using the glucose, your body is more sensitive to it because it's more metabolically healthy, if that makes sense. So aerobics have been shown to improve things like insulin resistance, lipid control, and endothelial function, and this is in type 1 diabetes mellitus. Aerobics can also improve triglycerides, so that's the fat in your blood, blood pressure, and insulin resistance in type 2 diabetes mellitus. So both of them can be benefited. And one of the things that's really cool here is aerobic exercise can decrease hemoglobin A1C by 0.5 to 0.7%. And I'm not going to get too specific on this, but essentially hemoglobin A1C is the average glycation of your hemoglobin in your blood over the last 120 days. And what this really means is it's making the diabetes disease process a little bit less severe. And it's just helping with controlling like the glycation of the blood cells, just a little bit. And after aerobic exercise, glucose remains elevated for about 2 hours. And this probably is because you're trying to refuel the muscle cells after you're using them so that they are full of glucose. And this can be dependent on glucose for 48 hours, and it can be independent for 2 hours. So the recommendation here to improve glycemic control is about 150 minutes a week of aerobic exercise, which is similar to the normal recommendation for adults. And the intensity level really depends on a lot of things, but moderate intensity would be RPE, or rating of perceived exertion, of 3 to 4 out of 10. So, it's moderate, maybe a little bit hard, but not too hard, right? Because vigorous activity would be 5 to 8 RPE, and if your disease process is a little bit more progressed and you have risk factors like hypertension, dyslipidemia, and retinopathy, this can lead to complications. So you really need to be working with a healthcare professional if you're doing more intense activity past walking, if you have diabetes, right? So low intensity aerobic activity of 60 minutes or more can improve the function of insulin in obese, insulin-resistant adults for a 24-hour period. So that gets to duration. So a minimum of 10 minutes is recommended, with the goal being 30 minutes. So you would warm up for 5 to 10 minutes, perform 10 to 60 minutes of aerobics, and cool down for 5 to 10 minutes. And we're progressing to just a total volume of 150 minutes a week of moderate intensity activity, and those who are safely able to perform 75 minutes a week of vigorous activity should do so, if it's safe to do so, right? So frequency would be 3 to 7 days per week, at least twice a week on non-consecutive days, to help with that insulin sensitivity, right? So if you would like to progress, you're going to do it on a duration basis, and if it's not contraindicated, you can increase to a vigorous exercise regimen. In resistance exercise, we're going to use free weights, body weights, machines, and elastic bands. And this is because resistance exercise can improve glucose management, right, as well. So that's pretty cool. And one thing about diabetes is it's a metabolic disorder with glucose. And if you improve your lean muscle mass, you're improving the store of glucose outside of your bloodstream, because your skeletal muscle holds things like glycogen, and glycogen is basically glucose. And if you can store more in your muscle cell, you're going to protect your body from being poisoned by glucose in your bloodstream, essentially. And resistance exercise can do like just normal things that it would do in adults, right? We would see a 10 to 15% improvement in strength, bone mineral density, your lipid profile, all good things, right? Because diabetes has been known to be a risk factor for atrophy, reduced muscle strength, decline in function, and strength training can help combat this. So when we're doing resistance exercise, we'd probably start off with a lower or moderate intensity of 15 repetitions, and then increase to 6 to 8 repetitions as we progress with perfect form. And you would also progress 1 set to 3 sets as tolerance and adaptations of the muscle improves. In activities, so you would want to do major muscle groups just for time efficiency, so compound movements that hit a lot of your joints. These are things like squats, planks, deadlifts, and rows. Frequency would be 2 to 3 days each week, and non-consecutive days, because you want to get that residual, protection from glucose, right? Because you're going to be more metabolically healthy for the next 24 hours after you lift or run. And to progress, you're going to do sets, reps, weight, and training frequency. Really, you would just follow the normal adult standards if you're not medically complex and if it's safe to do so. And so combined exercise would be both aerobic and resistance training. And this would probably give us the best results. However, this might be because we're just doing more volume. So you might be good doing one or the other, but really you would be wanting to do a program with both because it's been shown to have optimal glycemic and health outcomes in type 2 diabetes. So a greater reduction in that hemoglobin A1C was achieved with the combined training, and also improved weight loss, right? Because if we're expending more energy, we are going to pull from our adipose tissue or fat cells. And obesity is a risk factor we talked about. We didn't talk about it, but for diabetes, that the amount of fat cells in your body can contribute to the metabolic disease state that makes diabetes occur, right? So if we can pull fat or energy from those fat cells with a combined exercise regimen, we'd be good to go. Exercise has also been shown to help type 1 diabetes mellitus increase strength and cardiovascular fitness and insulin sensitivity. So those are all things that combined exercise can do. And children and adolescents should participate in 60 minutes per day of moderate to vigorous activity that strengthens their muscle and bones at least 3 days per week. And daily exercise would be optimal, but at least not taking more than 2 days between exercises to optimize the insulin sensitivity. And high intensity interval exercise gets a little bit questionable. It's obviously great if you can tolerate it medically, because high intensity exercise can actually increase glucose in the blood, because if you're stimulating your body to do something that's very high intensity, you're going to stimulate the release of blood sugar into your bloodstream to fuel the muscles. But this is a problem if you're already hyperglycemic, because you can get to a dangerous level of hyperglycemia that could be a medical emergency, right? So especially if you're medically complicated, work with a healthcare professional on high intensity interval training. But if you can do it, it can improve your A1C, it can improve your cardiovascular disease risk, improve your stroke volume, a lot of other nerdy things. And it would look like 10 repetitions of 60-second cycling at 90% maximum heart rate, especially after meals, can really help reduce hyperglycemia. So intensity level would be 65 to 90% VO2 max, or 75 to 95% heart rate max for 10 seconds to 4 minutes, with a 12-second to 5-minute rest period. And this is going to help essentially, will get you aerobically trained, but it can also help with glucose in the long run. It's just in the short term, low duration, high intensity intervals can actually improve or increase your hyperglycemia, which could be a good thing, or it could be a really bad thing, depending on who you are. And flexibility training. So you can use your full range of motion of all of your joints. So your arms, your knees, your ankles, everything needs to be stretched, depending on who you are. You might not need this, but if you do, you can do things like an individual flexibility program, or like group classes like yoga or Tai Chi. And the intensity level here is individual. So you're going to stretch until you feel a moderate pull or discomfort in the muscle. And you're going to hold for 10 to 30 seconds, repeat for 2 to 4 reps, and then 2 to 3 days, or you can do more as needed. And balance training can be really important for people with diabetes. And this is because peripheral neuropathy can cause things like just falls, and as we get older, our bones and our muscles get weaker, and we can be at risk for things like fractures, which can increase the risk of mortality, which, we can kind of prevent this by getting ahead of it and doing things like Tai Chi, resistance training, yoga, and physical therapy, right? If you need it, can help reduce that fall risk. And the frequency would be 2 to 3 days a week or more as needed. And then prevention. So physical exercise can do a lot in terms of managing the disease, but it can also help to prevent the disease in the first place. So activity was inversely correlated to the development of type 2 diabetes mellitus. For this study had a moderate intensity walking of like 18.2 kilometers a week, and it also improved their oral glucose tolerance with a 2 kilogram weight loss. So this is just saying that if you do physical activity for 150 to 175 minutes a week and you get a weight loss of 5 to 7%, it can reduce your risk of developing type 2 diabetes mellitus who are already pre-diabetic by 40 to 70%. That is an incredibly high effect size. And it's just saying that if you can somehow lose weight, that's 5 to 7% of your body weight with diet and lifestyle intervention, you can really go a far way in preventing the disease process, right? The CDC has a national diabetes prevention program because 1/3 of the country is pre-diabetic, and it's pretty effective. So it boasts that there's a 58% reduced risk of developing type 2 diabetes from pre-diabetes with this program, and you can find the link at my website, cartergansky.com. And for diet and weight loss, so every 1 kilogram of body weight, there was found to be a 16% reduced risk of type 2 diabetes mellitus, which is pretty big, right? That's only 2.2 pounds. So weight has a pretty sharp correlation with diabetes. And through changes in diet and physical activity, a loss of more than 5% body weight was shown to improve things like A1C, blood lipids, and blood pressure. And if you would like to lose weight, you can do it in a couple of ways. You can increase your caloric expenditure through exercise or physical activity. So it was recommended 500 kilocalories of exercise be done 4 to 5 days a week as recommended to lose weight. And in high-risk populations, 5 to 7% is recommended to delay that diabetes progression. And then there's some medical considerations. This is not medical advice, but just so that you're aware, there's things that can happen like the retinopathies. And if you are at risk for retinopathies, you wouldn't want to do deadlifting or high intensity sprinting, or even just moving your head forcefully, because you have these very small blood vessels in your eyes, and if you're at risk for a retinopathy, you really wouldn't want to increase your blood pressure more than 30 millimeters of mercury above resting. So things like powerlifting are likely off the table for you. And then hypertension can be kind of difficult to manage because exercise will in the long term help with hypertension, but in the short term, while you're exercising, if your blood pressure is 180 systolic, it might be kind of damaging, especially if you're already elevated. And then post-exercise hyperglycemia. So this is if you don't know what your glucose level is, you do a high-intensity exercise sprint, and you actually exacerbate the hyperglycemia that can be detrimental to your health. And then diabetic ketoacidosis, DKA. And so this is in type 1 diabetes mellitus. And basically what happens is you have circulating blood and blood glucose. And what happens with DKA is that there's not enough insulin in the blood to pull the glucose into the cells. So your blood is swimming in a very high concentration of glucose, but you don't have the insulin to shuttle it into the cells. So what will happen is you have to basically go into ketosis, which is a shift to use protein and fat for energy, and that produces ketones. And this can cause a metabolic acidosis shift of your entire body pH. So this can, cause also electrolyte imbalances, and it can be life-threatening. So a trip to the doctor would be warranted, and you would likely want to hold off exercise if you're in DKA. And then peripheral neuropathy. We talked about your skin checks for ulcers, because if you can't feel your feet and your hands, you want to kind of screen them for wounds so that you're not getting infected and warranting an amputation down the line. Also, if you have reduced sensation, you might not feel things like fractures in your feet. So that would also, you'd want to be careful with high impact activities. And blood glucose and exercise. So if your glucose is below 100, that could be hypoglycemic, right? Especially as you come down from 100 to 70 milligrams per deciliter, could be very hypoglycemic, and that could be dangerous because we said again, things like seizures and fainting can happen if you're hypoglycemic. So if it's 90 to 100, you might want to consult with your healthcare professional, and then you would want to eat 15 to 30 grams of carbohydrates, depending on the intensity and duration of exercise you're going to do, to see if it's safe and see how your glucose level responds. And if it's 90 to 150 milligrams a deciliter, you'd want to consume about 0.5 to 1 gram per kilogram of carbohydrate per hour of exercise, depending on your intensity and duration of the exercise, plus your insulin intake. It would all kind of change that prescription. And if you're 150 to 250 milligrams per deciliter of glucose, exercise without additional carbohydrates could be warranted until your blood glucose is below 150 milligrams per deciliter, and then you would want to start that normal prescription of glucose intake. And then if you are at a hyperglycemia, so if you start with 250 to 350 milligrams a deciliter, you would want to test for ketones, and if a moderate to large quantity of ketones is present, do not perform the exercise because you can make it way worse. You want to wait until it's below 250 milligrams per deciliter because you might actually exacerbate the condition. And if it's above 350 milligrams per deciliter, test for ketones, and if it's not present, don't initiate. If it is present, don't initiate. You'd want to consider insulin and then contact your healthcare provider to see why it's so high. And during exercise, if you are normoglycemic, you'd want to ingest 30 to 60 grams basically per hour to just maintain the blood glucose like as you would as a normal adult. And if it's low, you would want to take 10 to 15 grams of carbohydrates, see how it responds, and then adjust from there. So I hope this was useful. Again, I am a student physical therapist, not a medical provider. All of the information here was just for educational purposes only. I hope you found it useful, and I'll see you all in the next one. Thank you.